Hi everyone. So today we are going to discuss about the most common question we hear in our clinic. Why cancer happens to somebody? Why do you have cancer? So I tried to make it brief for all the people to understand a basis of what is called carcinogenesis. Carcinogenesis means the origin of cancer. So what you have to understand is there are many external factors and internal factors which produce together something called the origin or carcinogenesis. Internal factors is something called the genes. You would have heard of the word gene multiple times. Genes are, in a simple words I tell to my patients, that gene are the security guard or the caretaker of your cells. So it is basically without their knowledge, the cells can't have abnormal growth or an abnormal population of the cells. So basically genes are invariably involved in carcinogenesis. But the thing is, we can't control the genes. So genes are beyond our control. So it's already programmed, some things happen to the genes, we can't do anything with that. Only thing which we can control is something called the external factors. So I'll be discussing very briefly on the external factors. So the external factors which produces cancer are called carcinogens. So there are many carcinogens which has been listed or which has been found out by the scientists. Broadly they are classified into physical carcinogen, chemical carcinogens and biological carcinogen. Physical carcinogen is the most thing which you get exposed day in and day out, physical and chemical I mean. The most common example of a physical carcinogen is something called radiation exposure or an ultraviolet rays. It is told that if you walk in the sunlight for around half an hour or 1 hour, so you will have a lot of ultraviolet rays exposure, and because of this you can have DNA repair or DNA damage. But what happens is that our body is well programmed that it repairs all the damaged DNA correctly. So if that repair doesn't happen, so it can produce carcinogenesis or the origin of cancer. Melanoma is a very common skin cancer which has been attributed to ultraviolet rays exposure. There has been enough studies on physical carcinogens, and it has been told that basically in Hiroshima and Nagasaki, what happened was when atom bomb was dropped, even today the child who are born there has got increased incidence of cancer. It can be leukemias, lymphomas, thyroid cancers or many other cancer. So the radiation exposure in the environment is definitely a cause of cancer. Then the next question pertinently comes that mobile phone has got radiation exposure. So does mobile phone cause cancer? So as of now, the studies has not shown mobile phone produces cancer. The radiation levels are in the limits, but all these are new technologies which has come to us, and we need a lot of years follow-up to know that whether there is an high incidence. So as of now, no. Mobile phones and cancer incidence is not yet proved. So now we go to the number 2. That's called the chemical carcinogen. Chemical carcinogen is one which people normally discuss, and day in and day out we have a debate over that. That means I am eating sugar, I am doing hair dye, or I am having some carbonated drinks, I am drinking soft drinks, so whether it will produce cancer. So it's a controversial area. So there are some chemicals which has shown definite incidence of cancer. The most common chemical cancer is this thing is smoking. So smoking produces cancer is proven. So there are more than 1200 carcinogen potential in smoke, among which more than 40 is a type A carcinogen. It definitely produces cancer. And second thing is something called asbestos. So asbestos produces increased incidence of lung cancer and something called mesothelioma. Then there are many other carcinogens called benzene, benzidine, the people who work in a leather industry, who work in a glass industry, who has more exposure to petroleum products, who has got something which has got the dye industries. Even ammonia and some dyes has got a class B carcinogen effect. It doesn't mean that tomorrow onwards you should stop dyeing your hair. Continuous exposure along with the gene factors, when this both comes together, then it produces the origin of cancer. That's called the carcinogenesis. There are many other chemicals which are suspicious, but all this, the point to be taken is you should have a continuous exposure of this, and then you should have a more or some gene fault also happens. When both this comes in combination, then only it changes to cancer. The third one is something called the biological. or the living organisms which cause cancer. So there are some bacteria and virus which has been discovered, among which the virus is basically hepatitis B, hepatitis C, and Epstein-Barr virus. There are many other viruses also, but these are three are the most common. And in bacteria, it is mainly called H. pylori or Helicobacter pylori, which mainly produces gastric cancers or gastric lymphomas. The need for knowing about this viral and bacterial cancer is, to an extent, it is a preventable cancer. Even chemical is preventable cancer. Stopping smoking can reduce the incidence of cancer. But even if you have a hepatitis B infection, you have got treatment now. Hepatitis C has got treatment. Hepatitis B has got vaccine. So you can prevent hepatitis B virus. H. pylori has got H. pylori eradication therapy right now available. So any of these factors plus the so-called internal factor or the genes, when it combines and when both becomes faulty, it produces the initiation of cancer, and that is called carcinogenesis. So carcinogen produced carcinogenesis. From carcinogenesis, it reached to the origin of cancer. It's called carcinoma. That is how it is evolved. Thank you.